अस्सलाम वालेकुम एवरीवन।
सलाम।
उम्मीद कर रहा हूँ कि आप सब खैरियत से हैं और आज की शाम एंजॉय कर रहे हैं। इट्स अबाउट 5 p.m. हियर इन इंग्लैंड नाउ एंड आई मस्ट बी थैंकफुल कि अल्हम्दुलिल्लाह इट्स बीन अ वेरी ब्राइट डे। मौसम की बात करना ज़रूरी है बिकॉज व्हेन वी आर टॉकिंग अबाउट मूविंग टू इंग्लैंड आई थिंक दिस इज द फर्स्ट थिंग दैट हैज टू कम टू आवर अंडरस्टैंडिंग टू सेट द टोन राइट। My name is Sadiq Saeed. I am from MBBS 2012 batch. I finished college. Uske baad I spent some time in Bangalore working, and then now I've moved here. I'm working as an SHO at Pinderfields in emergency medicine in Leeds. Uh, I welcome you all to this webinar on working in the NHS and making migration to UK easier. And I'm only here to help you get the most out of this event. I am primarily assisting Dr. Khalid Bhai, whom has been the biggest pillar of strength and bonding and keeping all of us united together. I am sure all of the speakers here and people who are already in the UK will definitely agree to me. Today's webinar is basically designed to provide you with useful information and tips on how to pursue a career here in the UK in the NHS. You will not only learn about the benefits and challenges of living and working in the UK. I think you'll also be enlightened with the steps and requirements for migrating to this beautiful country. We have some amazing speakers lined up for you today who will share their insights and experiences with you. हमारे बहुत सारे seniors यहाँ पे हैं who've been here from different timelines. कुछ लोग बहुत पुराने लोग हैं, कुछ लोग अभी आ रहे हैं, including me. There are different people who've come in from different routes of getting their registrations and have started work here. Each speaker will give a presentation of about a small presentation, let's say. After these presentations, we will have a question answer session, which is open to all, where you can ask all your questions. I just want to let you know that please be patient with your questions. And to ask a question, you can type in your question in the chat box, and all your questions will be answered after or in a sequence. Before we start, just a few house rules for this webinar. I'm sure all of you must be aware by now. We are all used to online webinars. Please keep your microphones muted during the presentation. I know it is a Saturday night back in India. It can be a bit fun there, but please, just to maintain the decorum we have, please do not record or share any part of this webinar. And I also want to thank everyone for their cooperation and attention and also attending this. This is the second time we're doing this program, and I hope we will continue to do this. The feedback last time was very nice. At the end, we will also have a little feedback session where you can give in points and help us improve. Now, before I stop boring you with this and we move to the actual substance of this event, there is a small set of questionnaire that's going to come up. Please answer these questions so that we have an idea as to what audience we are catering. Khalid bhai, if you can get the questions, please.
Yes, I'll just share this link in the chat box. So chat box mein there should be a link. Everyone should be able to see a link there, kahoot.it. If you click on that link, it'll take you to a browser. Us browser pe you just have to put a name. It doesn't have to be your name. It can be anything, just a nickname. And then once we have everyone there, we'll start off with some questions. So there'll be 3 questions. You just select the answer, and then there'll be a time lag, just waiting for everyone to answer, and then we'll move on to the next question. So there'll be 3 questions in total. And then once you're done with all 3 questions, just come back to Zoom and we'll carry on. So if everyone could click on that link in the chat. Yeah, I see people are still joining. So anyone who's just joined, if you could all click on the link in your chat box, it'll take you to a different browser. And can we not send any text messages just yet? Can everyone just, so there'll be
They're asking for pin.
pin. Okay.
And yeah.
So it should automatically take it. I'll just check the. Yeah. Okay, this is the pin. Oh, I think it's got a player limit to it. Okay, anyway, I think Sadek will skip this. I will just carry on with the rest of it.
Yeah, I think we've reached a
I think
limit
this will
beyond
work.
our expectations, so that's okay. Before we move further, I would now want to introduce Dr. Masoor Bhai, who's a consultant in oncology, Swansea, and I'm sure he will guide us through the different routes of GMC registration. Masoor Bhai, whenever you're ready.
Thank you, Sadiq, and Assalamu alaikum, everyone. I would be talking about the GMC registration. Many of you will be knowing this, but it's just in a brief, I would complete this. And if any questions, I would take it we will take it together at the end. So for GMC registration, there are multiple routes. The first one, the most important, is PLAB. And other routes are exemptions from PLAB, which are acceptable postgraduate qualification, overseas registrations, sponsorships, and CSER. I will be talking more on the PLAB and then overseas qualifications, because I also use the overseas qualification route to get registered in GMC. So, and the types of registrations are provisional registrations, full registration, and others which would be less important to you all at the
Sorry to
moment.
interrupt. I think we can't see the slides. We can't see the slides.
Just a second,
Oh,
Mr. I'll just open your presentation.
Yeah, I thought, yeah.
Just give me 1 sec. Give me just a second, just loading up now.
Just letting people know who are just joining that if there's any questions, please put them on the chat box. Sure, one of us will note them and get back to them afterwards. Thank you.
Sorry guys, I had to switch laptops because my laptop started acting up. It's just loading up now, so nearly there.
By the time it's uploading, we can answer Hania's question. Is there any alumni group of Scotland? Like England का तो है, लेकिन Scotland में लोग हैं असफर तो है, but कोई group है तुम लोग का WhatsApp group? Yeah, I don't know.
Scotland में
व्हाट्सएप ग्रुप
ज्यादा
तो नहीं,
लोग हैं
लेकिन
नहीं।
हाँ कई लोग हैं।
अच्छा
पुनीत मोस्ट सेंट्रल है वहाँ पे।
नहीं है तो बना लो अगर कई लोग हैं तो।
स्कॉटलैंड में मेरे ख्याल ज्यादा लोग नहीं है। पेरेंट्स ज्यादा लोग हैं।
जो लोग हैं वो तो यूजुअली इसी ग्रुप पे हैं जो स्कॉटलैंड में हैं। तो मतलब ये यूके का ग्रुप है।
आई थिंक डिफरेंट
स्कॉटलैंड इंग्लैंड वेल्स अलग नहीं कर सकते इसमें।
Sadiq, do you have the slides? You can share as well. You're mute. You're mute. Turn your audio on.
No, I do not. I am requesting them. Once I get them, I will share them myself. I think we have an issue from the other side.
I have the slides. I can share.
So you
Masroor, can you share them yourself?
You share your screen then.
Set up purpose.
Yeah.
Yes, I think we have them now. Good, good.
And can you all see my slide?
Yeah.
The slide you can see, is it a presentation or it's PPT? Hello? Can you hear me?
Yeah, we can hear you and we can see your slides. You can continue, Masroor bhai.
Yeah. So sorry for this technical glitch. So there are a number of pathways for GMC registration. Number one is PLAB, and there are some exemptions from PLAB, like acceptable postgraduate courses or overseas registration qualifications. And the other one, most important one, is sponsorship. Caesar and CD. I will not be talking about the Caesar today because I don't think so it would be of any interest today. Next one, so What are the registration types? These are provisional registration, full registration, and GP and specialist registration. So basically, full provisional registration is who have passed the PLAB 1, PLAB 2, but they have not completed 2 years of work. Because here the internships are of 2 years, F1, F2, and in India it's just of 1 year, so they get provisional registration. And if in the later part of the career, if you apply for GMC, it would be a full registration. The PLAB, most of you may be knowing about the PLAB. It's a professional linguistic and assessment board. It's a two-part, part 1 and part 2. And the passing rate are very high, very good for this exam. And if PLAB, if you have like think about other countries, especially US or Australia, those qualifications are also now acceptable for GMC registrations or even Canadian exams, MCCQA, and other relevant European qualifications. And all the exams like membership exams or fellowship exams of Royal College or qualifications in English-speaking countries. No Indian qualification is in this list, and this will lead you to the post full registration. Now this one is the sponsorship one. It's basically you just have to pass an OE English exam, and then if the institute is offering you this is MTI pathway, you can get registered through their sponsorship. And it's for maximum of 2 years, and you come for tier 5 visa, and then you can switch to other visas after 2 years if you get the job. The good thing is there is no difference in registration whether you get through any of these pathways. There's you must have to return. This condition has been like no more since the COVID. You can switch to another visa tier 2 here itself. And these are Caesar. I would not be talking on this one today. So in conclusion, there are 3 pathways which we can consider. You can consider either PLAB or postgraduate qualification or overseas registration qualification and sponsorship pathways. Thank you. So this was just a short, quick overview of the pathways. Now, Sadiq, you can continue the, yeah. Thank you, everyone. I will answer the question at the end.
Right. Thank you so much, Mashkoor Bhai. That was of very good help. I think it set the tone for the different routes that we have. Next up, we have our very favorite Altamash. I'm sure who's here. Altamash has come here with his PLAB route. He's finished his MBBS back in Aligarh, moved here, probably the youngest from our group who's made it big. He's doing acute medicine. He's working as an SHO in acute medicine in Peterborough. Altamash will talk to us about PLAB and the UKMLE, the AKT, the CPCA, what advances, what changes we have now in the next couple of years.
All right.
Altamash, do you want me to share your slides?
Yeah, if you could share my slides, please.
Fair enough.
Assalamu alaikum, everyone, and thank you so much, Sadiq Bhai, for such a good introduction. So few people might already be knowing me from previous PLAB webinar and stuff. But those who don't know, I am Altamash. I am from 2014 batch JNMC. I came here in 2021. Since then, working in medicine in Peterborough for last 2 years. You're sharing the English slides, I think.
Sorry. What's happening on my computer? Please ignore. Okay, is this it?
Anyway, so there would be a lot of you who already know what are the different steps, but so it will be like repetition for you. But for those who don't know, we can go through it. So PLAB is considered to be one of the shortest and quickest way to get GMC registration. But obviously, there's been some delay in getting seats now. So Sadiq, can you please change the slides now? Yeah.
Yeah.
Yep. So as you can see on the slide, it is just a very quick summary on what are the steps that are involved in PLAB, getting registration through PLAB. First thing is you finish your medical school, or I mean, this is for fresh graduate, but anybody can appear for PLAB because the whole purpose is to get GMC registration. So get your medical school done. The first and most important thing for any sort of registration is that you should have an English test pass. So it could either be IELTS or OAT, which I think Zikulabhai will discuss in detail. Whatever you're comfortable with, you can go for that. Make a GMC account online, book your PLAB 1 seats. PLAB 1 is an MCQ exam and fairly doable. It's not very tough. So once you're done with OAT or IELTS, make your GMC account, do your PLAB 1, and then you have to come to the UK for PLAB 2 exam, because you can't take PLAB 2 anywhere else apart from UK. And for that, you need to apply for visitor visa. And once you're done with PLAB 2, then the last thing is to get your medical degree verified or certified by a process, something called as EPIC verification. So once that is done, you apply for GMC registration. That will be your full GMC registration. So now you are ready to practice in the UK as a doctor. And so you start your job hunting. You look for jobs, apply for jobs. And then once you start working here, you start as a non-trainee, which is something different from US, because you directly apply for training in US. You can start here as a non-trainee, and then depending upon what you decide later on, kis field mein aapko jana hai, either medicine, surgery, or you have an option of doing GP here as well. So then you can start your training. So this is a quick summary, and now I'm just talking more in detail about PLAB 1. So PLAB 1 is a MCQ based exam. Sadiq bhai, next slide. Can you hear me?
I can.
Yeah.
For some reason, I...
to the next slides. So it is an MCQ based exam. There are 180 questions you have to solve that in 3 hours. It is fairly straightforward. It consists of topics from medicine, surgery, and all the stuff that you study in medical school. The only thing that will be different from what we practice in India is having ethical scenarios, and then palliative medicine, and few bits from here and there. But it is a very manageable exam. As you can see here on the slide, these are the different things that you can use to prepare for it. We used to have Plabable, but I think they are changing the pattern of questions now. There are other question bank available now, med revisions. So you can use all these resources that you can see on the screen. You just need 3 to 4 months for preparation of PLAB 1, or even less than that if you are just studying. And then you can pass. Passing mark is never more than 117 to 120. And I mean, there are a lot of people who have recently passed PLAB 1, so they can also tell you more about if there is any change in type and pattern of the question they're asking now. And did I mention that it just happened 4 times in a year? So it's in March, June, September, and sorry, am I missing? Just a second.
August.
Yeah, August and September and November, right?
Yeah, that's right.
Yeah. Once you're done with PLAB 1, it is PLAB 2. So this could be something, this is something that we are not always used to, because we don't have, OSCE exam in India, but it is not in the pattern that they follow here. So you will be having 18 stations each. On the day of exam, you will be given 8 minutes. There will be actors who will be there inside portraying a patient. They can ask you to manage an acutely unwell patient. They can ask you to counsel the patient. There will be ethical scenarios and so on. So the passing, you just have to pass a minimum of 11 stations to achieve, to pass the exam. And then there is a set minimum number that you have to achieve. आप उसके ऊपर mark लाते हैं, you have to pass the minimum station and get the marks above the passing cutoff to pass PLAB 2. And the test center, I think it is still in Manchester, and they don't conduct it anywhere else.
Yeah, it's only Manchester.
Yeah, and most of the people, just to get an idea on how to appear or approach PLAB 2, they go for, there are different academies you can go for to get an idea how to, approach the station, PLAB 2 and stuff. But it is more of a communication. They're checking if you can communicate very well with the patient. So it won't be very difficult for you. So we're done with PLAB 1, PLAB 2 now. If you talk about how much it is going to cost, so it is in front of your screen. So the first thing is the English exam, then you go for PLAB 1, PLAB 2. And then the most expensive part is booking PLAB 2, getting a visa, staying in the UK, which can be expensive, coming here with a flight ticket, academy, it was somewhere around £500. And then living expense, it varies from person to person. So, but still roughly £400. And total, it will be costing you around 4 to 5 or 6 lakh, depending upon how long you stay here. But these are, just the basic skeleton.
Yes, I want to stop Altamash. I just want to say that this is only a rough estimate.
Yeah, it can be
So
more
you
than
come
that.
back to us saying, you said 4.5, now pay me my balance.
Yeah, I'm not gonna pay the remaining balance, but anyway, yeah. So basically now they are planning to start something called as UK MLA from 2024. That is what they were planning for. I don't know when they're going to start it, but it will be similar. I think they are just rephrasing the name of PLAB, and the only difference is that now the people who are passing medical school here in the UK, they also have to go through this exam. So you can understand it's more like a next exam, an exit exam from the medical school. So PLAB 1 will be called AKT. There will be MCQ question on computer. PLAB 2, you can say that they have rephrased it to CPSA. There will be, I don't think there will be huge changes in terms of the type of station and question they're asking. But unless and until somebody has appeared for it, you can't be sure. But I don't think they will change a lot. So that is it, UK MLA. People who have already passed PLAB 1 or have booked PLAB 1 seat, I don't think they have to worry too much about UK MLA. Even if at all they ask you to go for CPSA, they will give sufficient amount of time to get used to the format and give guidelines on what to follow when you're about to appear for that exam. So I think that is UK MLA. And yeah, I mean, this is beyond the scope of discussion, but yeah, this is how it works. Once you get your registration, you can come at any of these posts, either SHO, working as an FY2, trust grade. These are all the same thing with different name. So you can enter somewhere between foundation year 1 and 2. Then once you get your CREST form signed, and then you can apply for different training, GP, medicine, or surgery, whatever you want to go for. So yeah, this is, I mean, this is mainly for people who are still in medical school. So it is always a good idea not to have a gap during internship here. Reason being, they would ask you to explain the gap during internship. So if at all you're planning to come to the UK, there's no point of, taking a gap between your internship here. It doesn't mean that if you have a gap in your internship here, they will not give you registration. They will ask you to explain that you took a gap. If you are able to explain it, well and good, and they will give you registration. Passport, I wanted to talk about this because this is the issue that I face as well. Don't be careless like me. If you have a passport, just check if your surname is not blank. So what happened with me is that they put first name and surname together. So it will be an issue once you are here in the UK. So make sure that you get that corrected. And validity for PLAB exam, obviously PLAB 1 is valid for 2 years, and then you can within that time frame you can pass your PLAB 2. English test you have to plan. So if you're planning to apply for PLAB next year, then you have to make a rough plan that, okay, I will take my English exam in this month, then I'll apply for PLAB 1, and then I will go on for PLAB 2. And as I've already mentioned, that people are finding it difficult at the moment to get dates for PLAB. But yeah, what we can do, that is because of COVID and delay and everything. Any question, you can put it in the chat and then we can come back later. Thank you so much. Over to you, Sadiq bhai.
All right. Thank you so much, Altamash. That was quick and brief and in detail. I really appreciate how you brought up the points about the surname in the passport. Next in line, we have a man who needs no introduction, Dr. Zikrullah, who will talk to us about the English exams and the anesthesia pathway. Zik bhai has been here with us. He's come with the MTI pathway. He's done his MTI fellowship in Birmingham, is now working in Coventry.
Thank you, Sadiq.
That's it. Be.
Myself, Dr. Zikrullah. I've done my MBBS, my MD, and 2-year scholarship from Aligarh, and then I moved to UK in mid-COVID. And today I'm going to talk about the English exam. Sadiq, are you going to share the slide?
I think, just before I share, I think Khalid bhai is taking over. If he's not, then I'm happy to do it.
Okay.
Sorry for the delay, guys. We were not hoping.
Altamash,
Sorry,
doing
मैं
this-
कर रहा था, I'll just finish.
Yeah, Fayed bhai.
नहीं, ठीक है, Khalid bhai is back. I was just saying that if there is a delay, you can just explain about the passport thing. People didn't get that in detail, so if you can just.
Okay. So basically what I'm saying is, do you want to start, Zikula bhai? Sometime, because in India there's no concept of first name and surname. लोग उतना ध्यान नहीं दे रहे होते हैं, but here in UK there is a hard and fast rule. So surname is a separate mandatory field जिसमें आपको अपना surname enter करना होता है. For in my case, my passport first name or surname दोनों first name में था, given name में, and surname was blank. So whenever I had to enter my name anywhere, even for GMC registration or even for making an account with the government here or even for my bank account, then I had to use hyphen or dash or something like that, because technically I don't have any surname. Because अगर आप वैसा करते हैं, they will cross check it with your document. So what I'm saying is कि अगर आपका first name or surname passport में एक साथ है, then go to the passport office, ask them to put your surname in surname section, and that will be it. I hope that is clear.
You might want to do a paper advertisement, a newspaper advertisement for that. But जैसा भी है,
I think it's more complicated in India, but because I recently
Yeah.
got
You don't need to do that because you're not changing your name. You're just asking for correction of name. So you only do that when you're changing your name. So इसीलिए Altamash ने process पता किया था, and this has been a problem with a lot of us.
that is
So
in the UK, Fad bhai.
do that when you've still got time. क्योंकि यहाँ पर driving license हर चीज में you'll never be able to do that. So passport में you should have a separate first
Exactly.
name and a separate surname.
If you are
That's all.
planning to come to the UK, just get this sorted. Otherwise,
Alright.
it's complicated.
That is-
Now over to
Let
English.
us get back to the slides. Yes, Iqbal.
So hi. So I'm going to talk about English language test, and basically there are two type of English language test which is valid for GMC registration. One is OET, which is called Occupational English Test, and the other one is called IELTS, International English Language Testing System. So both of them are valid, and both of them are available to give in India. You don't have to travel anywhere except to the metropolitan cities, and the people from Aligarh need to travel to Delhi for that. So the pattern of both of them are pretty much same. They have four sections: listening, reading, writing, and speaking. And both of them, for the OET, you need B in all section, and there is no overall rating for OET. But in IELTS, you have to individually score more than 7 in each, and overall you have to score 7.5. Okay, but the thing is that in one, you have to have more than 8. Like you have to have listening 7, reading 7, might be writing, you have to have 8, and speaking, you should have 8.5. So that should make overall score of 7.5, and that you have to do in one sitting. This has been a very common question that people get fail in or unsuccessful in one section, like listening, they don't pass. And then they say that, can we go and sit for the individual sitting, speaking or listening so that we can pass? No, you cannot. You have to give all 4 sections in one sitting. And the validity of both of them is 2 years. 2 years from the exam, from the result date, and it should be valid. This is very important point, that this should be valid till your GMC occurs. If you don't have valid GMC, if you have got OET passed and its validity 2 years, and to pass PLAB 1 and PLAB 2 for any reason that you don't get seat or you don't get visa or because of any financial crunch, if you don't get to pass in 2 years, your OET certificate expires, and you have to give exam again in order to get the GMC registration. Because if 2 years pass, they won't accept the expired certificate for OET. And the cost of the OET is in Indian rupees, it's 34,000, and in IELTS it's like 13,000 or 14,000. I don't know whether they have increased the fees recently or not, but lastly I booked for one of my friend, and it was 33,000 for OET and 14,000 for IELTS, 15,000. It depends upon the dollar variation as well, because it fluctuates every day. Sadiq, next slide.
Oh, it's Khalid Bhai is doing it.
Okay, Khalid. So yeah, and so for the preparation of IELTS, you need to require 2 to 3 months, and the preparation material are available online from Cambridge IELTS books or IELTS online test, IELTS list website, and there you can have a listening, reading, and writing material. But you have to have practice speaking on your own. So you can have videos on YouTube which will show you that how to prepare on the speaking section, how to they see after the pronunciation, grammatical mistakes, everything, body language, everything. For the IELTS, exam occurs in 2 days. Listening, reading, writing occurs on the first day, and speaking is based on the second day. And listening takes 45 minutes. It has got 4 sections, 40 questions, and it's a one-time listening. You can't repeat the listening. You have to be very, very alert and be very, very attentive, because they are not going to repeat the listening part for you anytime. So you have to listen it very carefully, and it will be a conversation between 2 people, or it will be a command, or it will be a speech or lecture on any topic. Then again comes the reading section. It's of 1 hour. There will be a passage about like anything. It could be about history, about philosophy, about anything. You have to read the 3 passages, answer the question. 40 question will be there. Fill in the blanks will be there, true and false from the reading material, and the MCQs as well. Then comes the writing. Writing is basically 2 tasks. They will be giving you 1 hour. You can divide into 30 minutes. If you do the first task in 15 minutes, then you have the advantage for the second task. So the task 1 basically comprises of map, line diagram, bar diagram, or tables. So they will be giving you these modules, and you have to explain in your own language in 150 words that what do you understand from the diagram or from the map, anything, or from the table. You have to make it very, very clear, so that the examiner who goes through these sections understand it very clearly. Then comes the task 2, which is basically essay of 250 words. You will be given a topic like what is the impact of EV on the global warming. So you have to write advantage, disadvantage of electric vehicles, and you have to write about the global warming, and then you have to conclude it. And so in total, there will be like 5 sections. Some introduction, body paragraph 1, body paragraph 2, which body paragraph 1 consists of agree or advantage, or body paragraph 2 will be having disagree or disadvantage. And then you have to summarize it all the things into 3 or 4 lines, making a discussion and conclusion. And then comes the speaking, which is basically on the other day in IELTS. And the examiner will be asking you 3 parts, which will be introduction, 2-minute discussion, and follow-up question. It will be, they start with basically like, tell me about yourself. So you have to start your introduction. Then they'll say, tell me about what was the best moment of your life. Tell me how was your medical school. What do you think about the current political scenario? What do you think about the India being a superpower? So you have to speak on it very fluently, and you have to, and they listen it very carefully. And also it is recorded in one of the instruments, and then it goes for the assessment to the examiner in Cambridge. Okay, because IELTS is basically a Cambridge-based examination. So every question answer you write and do, it comes to the Cambridge for assessment. So next slide, Khalid. And then comes the OET, Occupational English Test. That also consists of 4 parts: listening, reading, writing, and speaking. In the listening, the main thing I'll tell you about the OET, that OET is basically totally a medical-based examination. What you will be listening, what you will be reading and writing or speaking. In your medical school, in your medical life, you must have gone through any time through the topics they will be giving you. Such as in listening will be actually of 3 parts. It will be basically conversation between doctor, patient, nurse or patient, or between GP or a patient. Reading will be of 60 minutes part, 3 parts. Part A is done alone, and the thing is that they give you 20 minutes for the part A, and then they take the paper and then they give the part B and part C. So you should be very careful that you should not take much time in part A. You have to be very quick so that you can manage the time for part B and part C. Otherwise, if the time runs out, they will take the part A paper and you won't be able to do the part A. Once it's gone, you miss the number. Then it comes the writing. Writing is basically two types of referral and discharge letter. Okay, only two type. And then speaking is a role play between a doctor and a patient. You will be, a candidate will be given a card, and all the relevant information will be there, like a patient coming with a diabetes, a patient coming with a brain tumor cancer, and you have to counsel him, you have to tell him about management, consultation, how you are going to do the surgery. If he's apprehensive about the surgery, you have to counsel him, you have to calm him down. So this is how the speaking works. And you have to follow the format and structure, and the OET materials are available on the OET official site as well as on Telegram. There are numerous channels on Telegram. If you join them, they have got all the structure, all the PDF material, so you can go through them and practice. So comparing the IELTS and OET, IELTS is a cheaper version. Seats are readily available, and it happens almost every week and every day. And there are many centers all around the country. In India, probably you will go to Delhi. From people Aligarh will be traveling to Delhi. And the thing is, it's a general topic. As I told you, that the topic will be from history, topic will be from philosophy, from geography. So you have to go through that topic very, very carefully. While OET is costly, it like 33,000. It's a big money for from India, but it's I don't think it's hard to book a seat. But the thing is that it occurs twice in month, on the first Saturday and the fourth Saturday. You have to book the test, and now they have come up with more centers, so you will be getting seats very easily. There won't be any problem getting seats. And but the thing is that OET is easy to pass. As I told you, that the topics covered in OET is sometimes you have been through your medical college. So they will be giving you on diabetes, they will be giving on Foley's catheter, on the nasogastric tube, on the CT scan, MRI, hypertension. So these are the topics covered in OET, and it is very, very easy for medical students, because frankly, my experience, I'll be speaking.
Sorry to interrupt, Zikrullah. I think it's getting late in India, so we need to wrap this up.
Okay.
Please, yeah.
Okay, yeah. So OET is basic, and if you say what you should go for, IELTS or OET, then I'll definitely tell you to go for OET, because it's easy to pass. And if anybody is interested to go for English exam and specifically OET, I'm very much happy to help them with the material and with the practice of speaking and writing as well. Thank you
so much, Zigbhai.
Thank you so much, Zikrullah bhai.
That was very nice. I think we needed that in detail, because irrespective of whatever pathway we come, we do have to go through the English pathway. Next is Zafar Bhai. Zafar Bhai.
I think Zikrullah wants to speak about anesthesia as well.
All right.
I'll speak about the anesthesia.
Yeah, so we'll just have a really quick skim through this.
Yeah. So about the anesthesia pathway, there are basically three pathways: FRCA exam, the Royal College exam, European Diploma exam, and FCAI, which is Irish exam. And the other pathway is MTI. FRCA has basically two parts, primary and the final. And the primary has two parts as well. Can you change the slide, sir? And then the final has also two pathway. So the primary, basically you need, if the people who are from India who wants to give exam, they can have the temporary exam eligibility, which can be signed off from the college itself, from any consultant, and then you can apply on the FRCA website, and they will give you the temporary number, college number, and then you can sit for the primary FRCA and give the exam. But for the final FRCA, you need to have the NHS experience, minimum of 6 months. They need the experience of NHS. And the final exam also consists of MCQ and OSCE. And then the other exam, next slide, sorry. Yeah, and both of them consist 60-60 of the SBA question, the MTF has been wiped out, and all the questions are not now SBA, and the OSCE is the station like PLAB 2. So you have to go on the different station and discuss all the topics, whatever is given to you. Then comes the Irish exam. Is the MCQ based examination, and as well as OSCE. So every exam in UK has basically MCQ and OSCE. So the pattern is pretty much same like final FRCA. So there's nothing different. Just you have to go through the material differently. In the Irish exam, I think the question Q bank is of very much help, as well as podcast. But for FRCA, you need to go through the online question bank and as well as the Royal College question bank. And then comes the EDIC. EDIC is also eligibility for the GMC registration, European Diploma Anesthetic and Intensive Care Examination. And this also consists of MCQ as well as OSCE. And after passing the EDIC, you get the GMC registration and you join as a specialty registrar or the senior registrar here, and not as a junior clinical fellow. So it has paper 1, which is basic science. And then it has 60 MCQs, which is of 2 hours, and the paper 2 consists of clinical anesthesia and intensive care related question, which also has got a 60 MCQs, which is basically MTF as well as SBA. And then comes the OSCE, in which you get the 4 oral stations, and you have to spend 25 minutes on each, speaking on the various topic, whatever is given to you on exam. And then comes the MTI pathway, which is the sponsorship pathway, and sponsorship pathway from Royal College through MTI. And what you can do is you can apply on the Royal College website, and what they do is they match you to the respective different trust. And if your CV gets accepted, then the respective trust sponsor you the course, the Tier 5 visa and the certificate of sponsorship. And once you get the certificate of sponsorship, you can apply for the visa and come here and join the NHS trust and do your registrarship. And the GMC is also sponsored by the trust as well. So in this pathway, you don't need PLAB, you don't need nothing. All you have to do is prepare for the interview and apply through the NHS jobs or the track jobs, and through the Royal College website. Thank you.
Thank you so much, Zigbhai. That was very informative. I think next, I'm sure if anyone's interested in anesthesia, I think you know now that Zigbhai is the man to go to. He's going to ask and solve all of your questions. Quickly moving ahead, now we have Dr. Zafar Bhai. Zafar Bhai will talk to us about the medical training initiative program. How do you apply to it, and what are the outcomes and challenges you face when you come via MTI? Zafar Bhai has been here in Birmingham. He's finished his 2 years fellowship in orthopedics. Zafar Bhai is also the most versatile and has the most colorful Instagram we have among all of us, I believe. So if you have followers, he's the guy. Go on, Zafar Bhai, all yours.
So, thank you, Sadiq. So I'll quickly go through this medical training initiative, but anyone has any questions regarding orthopedics, he can also ask me the same. So medical training initiative is mainly for people who are post-PG. And so if we can come to the next slide. So as Zakrullah has already told us that it is for 2 years, and it allows the doctors from abroad to come and train and work in UK. The other thing to note that this is a Tier 5 visa. So normally when you clear any specialty exam or PLAB, you come on the Tier 2 visa. And I'll tell you the difference, what's between the difference between Tier 2 and Tier 5 visa. We can go to the next slide. So eligibility is at least 3 years of postgraduate experience. It doesn't mean that you have to work, like you have to be experienced 3 years post-PG, like your 3 years of PG is counted in these eligibility guidelines. But obviously, when it is post is advertised by individual college, they sometimes wants like 5 years or 4 years of experience. That means PG, like MSMD, plus 1 year or plus 2 years. But minimum is like you have to be completed your PG. And most important thing is clearing your English exam. That's the most basic step. And then once that's done, your MBBS degree needs to be certified by ACFMG or EPIC verification. You don't need to certify your postgraduate degree. And another condition is this, that the last 12 months you have been working continuously. So you have to show your work experience of like last 5 years. They want like last out of 5 years, you have to be working 3 years, but the last 12 months, they want that you have to be working continuously. Next slide. And process is just you have to follow your Royal College websites. If you are from the gynae team, like gynecology, it has to be Royal College of OGT website, or RCP medical side people. You have to follow the RCP website, and the surgical side like RCS website, and you have to follow them and just search. And some whenever the post comes in, they will advertise, and you have to just apply on them. Then the Royal College, they look at your CV, they look at your logbook. So obviously you have to maintain your logbook. That's the most important thing that we don't do back this in Aligarh. So they'll look at your eligibility, look at your CV, look at your logbook, and then they inform the colleges where the vacant posts are present, that these are the applications they have got, and then they match different applicants to different colleges if vacancy is there. Next one. Advantage is obviously once you are that past the PG stage, then getting back to the study table is very difficult. You are in practice, you don't have time, and all these things, you don't have time to get the exams done. So this is the advantage of PG, that MTI, that you get the full GMC registration without getting any exam. And obviously your training, your pay, the opportunities, they are same as to any other trainees in UK. Next slide. The disadvantage is that this is for 2 years only. So at the end of 2 years, you either have to go back home, or you have to apply for a new job as a tier 2 job, which is easier as compared to when you're applying from India, because then you have 2 years experience of NHS job, which boosts up your CV from here to here, because now you have NHS experience. So although you have not cleared any specialty exam, but your CV becomes good because of the previous experience. And the second thing is that your 2 years on this visa, it doesn't count into the time spent for citizenship. So in the long run, you can think that those 2 years was just a stepping stone, and it won't be counted, but it helped you for getting your first steps in UK. Yep. I think that's it for MTI. And if anyone has any questions for MTI or orthopedics as well, they can just put in the chat group.
Thank you so much, Zafar Bhai. That was a quick summary of the medical training initiatives. Next up, we have Nameer Bhai, Dr. Nameer, Mr. Know-it-all on the Department of Surgery. I would say I've gotten requests to introduce him as the most eligible bachelor, but then I think he's off market now. But then we'll stick to know-it-all with surgery then. Nameer Bhai is a surgical trainee. He's done his MRCS and is now working in Dudley. Naveed Bhai, over to you.
Yeah, quick introduction. I've got a historical relationship with AMU. I did my +2 in AMU. Then I went out to do my MBBS from PMCH and my MS. And then I came into the UK after my senior residency. So we just do a quick discussion about the membership exam, the MRCS. So it's an intercollegiate exam for surgical trainees who wants to become a member of one of the 4 surgical royal colleges of the UK and Ireland. Like Masroor Bhai said in his first presentation, so the benefits of this exam is that it makes you eligible for the GMC registration. You can bypass the PLAB exam, so you don't need the PLAB exam anymore. It is more appropriate if you are sort of already done your MS in any of the surgical branches, because the MRCS is not meant only for general surgery or GI surgery. Even if you're in orthopedics, or even if you're doing ENT, you can still do MRCS and then carry on and get registered here. It is an essential criteria if you want to switch on from an SHO level or junior level job to a registrar level job. They sort of consider it as an essential benchmarking exam that you can move over to registrar level jobs. It's an acceptable postgraduate qualification, like we discussed. You can go to the next slide, Sadiq.
No, Khalid Bhai is doing it.
Oh, sorry. And then it just indicates that you have got the necessary knowledge, experience, and competence equivalent to a core trainee. So the way I think one of the slides showed the surgical training pathway. So the surgical training pathway in the UK is nearly 8 years. The first 2 years is known as core training. And at the end of your core training, you give the MRCS exam to become a registrar, which is ST3 equivalent. So Indian context से ये है कि अगर आप MS surgery कर रहे हैं, MS ortho कर रहे हैं, तो you don't need to come in a junior level. आप MRCS करके आ जाइए and you can start in the middle grade or registrar. कोई eligibility criteria नहीं है first part के लिए. You just need to have done your MBBS from any of the medical colleges जैसे कि JNM, CMU या कोई भी Indian colleges जो कि on the register है. So which is probably all of the medical colleges. Brief talking about the exam. The first part is a written exam. It has two parts, part 1 and part 2 of the first part of the exam. Pehla wala is just applied basic sciences, and the second one is principles of surgery in general. The important to note is that the applied basic sciences has got a lot of other questions, like it has got anatomy and surgical microbiology and surgical pathology, जो कि quite basic है. कोई अगर PG entrance की तैयारी कर रहा है, then that's quite achievable. Principles of surgery in general के बारे में basic information ये है कि it has got like questions from orthopedics, from neurosurgery, from general surgery. So it's the surgery in general. Total 5 hours duration है, 3 hours का morning paper होता है, 2 hours का afternoon paper होता है. I think the current exam is being done online. I think Saad Naseem has recently passed the exam, so someone can get in touch with him क्योंकि मेरा exam कुछ दिन पहले हुआ है. And I think Kamran भाई ने भी अभी किया है, so you can get in touch with them. Ideally 2-3 साल के बाद, so you can give it in, अगर आप PG कर रहे हैं तो you can give it in JR2 level. Cost of the exam थोड़ा सा ये outdated है, लेकिन I think it has gone up to nearly 570 or 600 pounds. It is an expensive exam, so make sure you have studied enough to pass it. Online resources जो सबसे relevant है वही MRCS है. It's a cheap website. I think it's like 50 or 60 pounds. और past test जो है वो I think it's around 110-120 pounds. The good thing is that this exam is done in India, so you don't need to travel anywhere. So you can give this first part in India. I think सारे metro cities में होता है, but I'm definitely sure कि Delhi, Calcutta, Chennai, Hyderabad ये सब जगह होता है. Part B is the OSCE exam, like we were talking about the PLAB exam. It's an objectively structured clinical exam. उसमें मेरे time में 18 stations थे, हर station 9 minutes का था. I think it is still very much same. 18 stations में the 8 stations knowledge के हैं, 10 stations skills के हैं. They might ask you to do a small skill like suturing a wound or excising a melanoma and then closing it up, draining an abscess. Again, the benefit of this exam is that you just give it in India, so you don't need to travel to the UK, you don't need to get a visa, you don't need to get registered here. So you just give an exam. Part B is a bit relatively costly. I think it has gone from 977 से जाके 1047 हो गया. Again, I don't think they have got a criteria, but I think it is recommended. उन लोग कहीं पे उन लोग कहते हैं कि it's recommended to give the exam when you have got more than 3 years of surgical experience. It is not an essential criteria. You don't need to have a certificate to prove that you have done 3 years of any surgical ये. लेकिन postgraduate level पे India में MS करने के बाद this is the exam to be done. इसकी जो online resource है वो passthemrcs.com है. That's it really. So that's another 100 pounds of expenditure. So जैसे कि PLAB का जो अल्तमश बता रहा था उससे comparison किया जाएगा तो it's nearly 1,600 या 2,000 pounds in total. Again, I'm not going to pay the difference अगर उससे ज़्यादा या कम हुआ तो. And any other issues, please feel free to contact.
No problem. Thank you so much, Naveen. That was beautiful. When we were doing this, and we were asking questions, we had a lot of questions coming in for ophthalmology. So now we have Dr. Fahad Bhai, who's done his clinical fellowship in ophthalmology. He's working as an ophthalmologist in Wolverhampton now. Fahad Bhai, a quick discussion about ophthalmology, please.
I'll just mention one thing. What Nameer said, the exam for ENT is different. It's not the same MRCS exam. So the MRCS exam for surgery, orthopedics, plastic surgery, vascular surgery will be the same MRCS, but the one for ENT is a different exam.
That's right. I think the ENT, the first part is probably the same. The
First
A,
part is the same.
but
First part is
part
the
2
same.
के लिए लोगों को DOHNS देना है, which is Diploma in Otolaryngology, and they are eventually awarded MRCS ENT, but the exam, as you said, is not the same. It's the second part is the different exam.
Okay, I'll start. Assalamu alaikum all. My name is Fahad. I've done my +2 from AMU and then moved on to Patna to do my MBBS and then done my MS from India. I went to South India to do a fellowship and spent 3 years in down south in India and then moved to the UK. I'll be discussing a few things about ophthalmology practice in the UK. Thank you, Khalid bhai. So, I'm talking more from a perspective of an ophthalmologist. You've had many people discuss, the ways to get GMC like Masoor and others. So obviously, one way is through exams, and exams can be PLAB or the Royal College exams, and the other is a sponsored GMC registration, which is also called sponsorship pathway. So if you get your GMC through that, the only thing you need to do is get the English exam. Right. So different people might have different motivations to move to the UK. Some might be coming for, British nationality, passport, ILR. Some might be coming for superior quality of training in a developed country. The two types of visas on which you get this tier 2 and tier 5, I'll just skip that, as been discussed before. So, what are the pathways to enter into the UK for an ophthalmologist? So one of them is postgraduate exams. There are 3 kind of exams which you can give now, and you can get GMC registration through that. FRC Opt London, FRCS Opt Glasgow, and FRCS Edinburgh. Right. So 3 different exams. So the thing is that it's best to give the first one, which is FRC Opt London, because once you move to the UK, your career only progresses with this exam. The other 2 exams, they become redundant and you can't use them for anything else except to get your GMC. So to progress in your career in the UK, you'll only need 1 exam, which is FRC of London. It's kind of a monopoly by the Royal College of Ophthalmologists London and kind of discrimination against the Glasgow and Edinburgh College, but that's how it is now. The other one obviously is PLAB. I know a lot of people who have done 5-6 years of ophthalmology, PG, SRship, but then they've given PLAB and moved to the UK after finding a job. It is slightly tricky once you've done ophthalmology for a while, but then it's the easiest and quickest pathway. If you get your dates for the exams, you can sort out PLAB within a year, 9 to 12 months. The MTI pathway, which Zafar has already discussed, obviously exists in ophthalmology as well, but it's very difficult to find a seat. This goes through Royal College of Ophthalmologists. Now, there is a slight difference to what Zafar has explained, that you can get MTI in ophthalmology via Royal College of Ophthalmologists. And if you're lucky, you can even get it on tier 2 visa. Usually, MTI is on a tier 5 visa, which does not count towards your citizenship. But one of my friends has just got MTI via Royal College, and he's been lucky enough to get a tier 2 visa. So sometimes you can get that. It's just that you need to kind of ask them that, that you need to ask the trust that can I get it on a tier 2 visa. Now, the other option is clinical fellowship pathways, which also come with sponsored GMC registration, and they are on tier 2 visa. These are very few in the UK. And what you actually do is, if you've got your English exam and you are kind of looking for ophthalmology job, you just need to go to the website called Track Jobs and NHS Jobs, and you keep searching for jobs. What you do is you open the job specifications and you look for the essential and desirable criteria. So if a job, if it's mentioned that GMC registration is an essential criteria, it means that you will have to get your own GMC. If it doesn't mention that, it means that you can, or some jobs will mention that they will sponsor GMC registration. Now, another pathway, which is called MCH ophthalmology, which also comes with sponsored GMC registration and with tier 2 visa, is a pathway which is sponsored through a few universities. I'll discuss this in one of the next slides. Khalid, can we go to the next one? So FRC Opt exams have got 4 parts. FRC Opt part 1, then there is a refraction certificate exam, then there's a part 2 written or part 2 MCQ exam, and a part 2 OSCE exam. So for part 1 exam, you don't need any prior ophthalmology experience. It's an online proctor exam, 2 MCQ papers, 90 questions each. 6 attempts are allowed. The fee is £635, and it's actually got everything: optics, refraction, basic sciences, anatomy, physiology, statistics. It's all basics actually. Next slide, Khalid bhai. So this is actually the fees for the exam if you're giving. So I'm only discussing about FRC Opt London, because the other 2 exams won't help you progress your career in the UK. So you get FRCS Glasgow or FRCS Edinburgh, and you come to the UK. And if you want to progress, you will need FRC of London. So these are the fees for the various different steps. And mind you, it's different in UK and overseas. So if you come by a sponsorship pathway and give the exams in the UK, it will be much cheaper. Or otherwise, you'll have to come on a visit visa, tourist visa. Next slide, Khalid bhai. So we've discussed about MTI, that the very few seats comes with sponsored GMC, and if you are lucky, you can get it on a tier 2 visa. But otherwise, it's tier 5. But it's not very useful to to pin your hopes on MTI ophthalmology, because there are very few seats. You'll have to be very lucky to get this. Now there's something called MCH ophthalmology, which is kind of a degree sponsored by a university, but you are working full time, and you get sponsored GMC. You get a tier 2 visa, and which means that after 5 years you can apply for British passport. There is a fee to this program. It's usually around £35,000, but you need to pay like 10 to 12,000 upfront, and after that, the rest of the money is deducted as installments from your salary. So you will get the same salary as a junior doctor. You will work the same like a junior doctor. You will do theaters, lasers, clinics, everything like a fellow, and the rest of the amount will be deducted from your salary. So you can manage decently well with this pay. So the thing is, you need to arrange 10-12 lakh rupees to pay the upfront amount. And you will work as a full-time fellow with just 1 day of university lectures, for which you will be given time. So the good thing about this is that you'll save a lot of money on exam fees, because whatever everyone has explained, that the total cost of the PLAB pathway is say 6 lakhs, or MRCS is blah 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 blah, but you end up not passing all exams in your first go. So you actually end up spending a lot of extra money as well. You obviously need IELTS and OET, which Vikrula has explained in quite a bit of detail for everything. So you need that for everything. Any GMT registration, this is the prerequisite. One of the universities is Edge Hill University, but I know there are other universities which also go for this MCH program, and it's a pretty decent way to get GMC registration. So the end result, what you want is to get a GMC registration to practice in this country. Next slide, Khalid bhai. So, and the question which a lot of people who are in ophthalmology have is, what do I do once I move to the UK? Like, suppose I've been doing ophthalmology for say 7-8 years in India. I've done my MS, I've done an SRship, or I've done a fellowship from one of the premier institutes, and I'm practicing as a consultant in Shankar Netralaya or Arvind Eye Hospital, and I've got pretty decent experience. Now, what would I do once I move to the UK? So the reality is that obviously, if you are practicing and doing a significant amount of surgeries in a good center in India, you will certainly get slightly de-skilled when you move to the UK. It's not that you'll have the same surgical exposure in the UK. Is not the same as in India. In India, obviously, you've got a massive population, so massive number of surgeries. So you will get de-skilled, but people have their own motivations to move to the UK, quality of life, blah 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 blah, other things. So I mean, that's your decision to take. So once you come to the UK with a GMC registration, obviously, you can either apply for specialty training to finish your training and become a consultant. Right now, that pathway is on hold, and there is no entry to ST3. The other thing is, you could work as a specialty doctor and do something called Caesar, which I think Masroor did talk about, which is a pathway in which you need to prove all evidence equivalent to what a UK trainee would do to become a consultant. So yeah, I mean, that's generally about ophthalmology, but yeah, we'll take questions as more towards the end. Thank you.
Thank you so much, Fahad Bhai. Fahad Bhai, there's a quick question before we just finish this year. It's from Muhammad Imran. It says, will FICO help in any way with ophthalmology? And then we'll move to Naveed Bhai.
Unfortunately not. Unfortunately not. FICO used to be a pathway to get GMC registration till 2018, and because you could send your FICO degree to the Royal College in Edinburgh, and you could get an MRCS Edinburgh in exchange for that. But now it doesn't work that way. So yeah, FICO won't help you get GMC registration now. It used to happen till 2018.
Okay, thank you so much, Fahad. I appreciate it. Moving on. I think a lot of questions have also been coming from medicine now. So we have Nabil Bhai. Nabil Bhai is a surgical trainee. He's doing in diabetes and endocrinology. Sorry, a specialty trainee. I'm sorry about that, Nabil Bhai. He's working at the Royal Liverpool Hospital. He's been here for some time now, and he will talk to us about the different pathways about MRCP.
Assalamu alaikum. Is there anyone who's here?
Yeah, I'm taking over.
Okay, you want to do this?
Yeah, Khalid Bhai, I'll take
Okay,
over.
I'll just stop sharing and then you can take over. While we're setting this up, Sadik, you can start sharing now. So what I'll do is, यहाँ पे काफी लोग हैं, I think, जो interested थे ophthalmology में. What I'll do is we've got specialty specific groups यहाँ पे UK में, जो हम लोगों ने अपने medical association के बनाए हैं. So I'll share some links in the chat groups, and maybe people in the you can join your relevant groups and just ask your specific questions there.
Nabil Bhai, is this your present? This is what it is? Okay.
Assalamu alaikum. I'm Nabil. मैंने अपना MBBS MD SR-ship सब अलीगढ़ से की है, and then I came here through the MTI path as an endocrine reg, and then finished my MRCP, and now I'm an ST6 in endocrinology at Royal. I'm wary of the time. So is anyone particularly interested in MRCP? Because I'll whiz very quickly if no one is actually preparing.
I think we have a few participants.
Yeah, you can move to the next slide.
Okay.
So essentially, people who are in Aligarh, I would advise MRCP only if you are doing MD medicine or planning to do MD medicine, not as a substitute for PLAB if you want to come to the UK quickly. It's good if you want to apply for MTI jobs because you get preference if you have a couple of pass of MRCP. But recently MTI jobs have gone down as well. MCI has recognized MRCP as a PG qualification in India as well, so you can work as an MD equivalent. Yeah, next. Yeah, it's like I said, it's prestigious. And next slide, Sadik. So I'll just briefly tell you why and when you need MRCP. So once you do your PLAB, you are entering UK, or if you're doing MD medicine and you want to come to the UK, MRCP is needed when you apply for either internal medicine training or you need it, like it's a prerequisite for specialty training. So people here do MRCP during what we call the IMT training. So at this level, you need MRCP to enter into any specialty medical training, be it endocrinology, cardiology, dermatology, even oncology. You need MRCP. And then once you go into specialty training, you get the CCT. Next, Sadik. Now, previously there were 3 MRCPs that were happening, but now it's all combined into one. So it's the Royal College of Physicians exam. It happens 3 times a year. It's got 3 parts. Part 1 and 2 are written, so it's MCQ based. There's no negative marking, and part 2 is the difficult clinical part. The good part is you can do all of these parts in India if you're planning to do it in India. It happens 3 times in India as well. So I did my part 1 and 2 in India. Process and fees, I think this has changed now. So previously when I did it, like I think last year they have changed the fees. It's close to £600 for part 1 and 2 and £1,200 for PACES if you're giving it in India, and close to I think it's 800 now for PACES, the third part. I'll go through this very quickly because if anyone is interested for MRCP, we have the group. If anyone is interested among the MD candidates as well, we have the MD Medicine alumni group, so you can just contact me. So the only essential requirement is 1 year medical experience after MBBS. I don't think it's quite strict. It's got 2 parts, 200 questions. It's very easy. You just need like a past medicine subscription and you should be able to go through it. Same as for part 2. It's image based. So you get CT images and X-rays and stuff. PACES is the difficult part. I would recommend PACES only if you're doing MD medicine, because this is the part where you need the the medicine experience to pass it. You can do it after, even if you're past part 1. So you don't need to do part 1, 2 and PACES. You can do part 1 PACES and then you can do your part 2s. So yeah, it's got 5 stations. Like I said, if anyone wants to get in touch with me about this, I can go into detail about what you need to do for this, but basically it just requires more practice. This is kind of the scenario. It's like a half-day exam. There are abdominal stations, neurology, cardiovascular, communication, respiratory, and 2 like outpatient clinical stations. This is changing from the end of this year. There's a PACES 23 that's coming in. So yeah. Preparation and resources. For part 1, I would just suggest past medicine. There are other stuff to do, but yeah, past medicine should be enough. Yeah, same for part 2. I think past medicine and 1 book called Sanjay Sharma is fine. And for PACES, it's just practice. And there's a past test subscription where it has got like all the videos of all the cases that comes in PACES. Like I said, PLAB or MRCP, if you're planning to come to the UK quickly, go for PLAB. I would suggest MRCP for people who are doing MD medicine. You can do your part 1 and 2 while you are GR2 and then give your like PACES after you're finished your MD. It will be very easy, especially after the grueling MD practical exams there. So it should be easy.
Right.
Yeah, if you have any questions, you can just drop me an email. We have got that group. You can get my number from there. I can help you.
Okay. Thank you so much, Nabil Bhai. Just quick and good, easy peasy, as expected. Thank you so much, Nabil Bhai. Any questions, like said, you can pop in your questions in the chat box. Nabil Bhai will be happy to answer them. And he's also there at the question answer session after this. Moving forward, we have Asfar Bhai. Asfar Bhai has a background in psychiatry. He's a psychiatrist and is now a GP trainee in Newcastle. Asfar Bhai, you here? Yes.
Yeah.
There you go. Asfar Bhai.
Yeah.
Just gonna quickly share your things. Just give me 1 minute.
Yeah. Thank you, Sadiq. Yeah. Thank you very much. I will just quickly go through what,
I already love your slides, Asfar Bhai.
Yeah. I don't think I will go through all of them. Just I will quickly tell about me and what I'm doing.
All right.
So basically, I did my MBBS and psychiatry back from Aligarh, and then me and Nabil both moved together through MTI route. And then while doing my MTI, I kind of got attracted towards GP, and it's kind of a family medicine, but in UK we call general practice. So it's a shorter training, 3 years just, and you are kind of a qualified GP. And things have worked well for me, alhamdulillah, and I'm kind of enjoying my general practice at the moment. And just a few kind of things about GP, that you don't have to be placed in the kind of a hospital. It's basically kind of a small mohalla clinic type of settings. You work alone, and the thing is that it's very flexible. You have a choice what days you want to work, what time you want to work. And like currently I'm working only 2.5 days, and most of the time I'm at home. So it's good. And I think if anyone interested in psychiatry and GP, then they can contact me. So yeah, that's the GP training map, yeah.
Mhm.
And the secretary is a bit longer. It takes 6 years to get fully qualified here.
Otherwise,
So after plab, yeah, it's a good option if you want to, earn quicker and, go through your training quickly. So these two specialties are kind of, cooler in the kind of a work-life balance wise.
Aswar, another question keeps coming up a lot. I think
Yeah.
I'll ask it now. What the question comes up is that, is it easy to just get into psychiatry after we get our GMC registration via any route? Does
Yes.
that
So
get
yeah,
into-
so I have seen a lot of people, who has done plab and they give their exam, that MSRA exam.
Correct.
Yeah, from their home country, and they come directly to the psychiatry training and the GP training.
Mhm.
And because it's a bit easier other than other specialties, so you get into the training quickly. The competition ratio is a bit low, as well as you kind of get through that training as well.
Mhm.
So it's a good option if you are struggling with the job in kind of a trust gate job. So it's a good option to prepare for the MSRA, give the MSRA and directly come into the training.
Right. I think that sorts it up. Aswar, thank you so much for that quick.
And the one thing I wanted to know, there is one thing called GIPSY, GP with special interest. So if people who are struggling to get job in ophthalmology, in dermatology, kind of those specialist branches, ENT, so they can do their GP training and they then can work as a GP with a special interest in any of their specialties.
All right. I think we have. Thank you so much, Aswar. That was a quick introduction about GP and psychiatry. Very well done. I think we have the links in the group, and this is the end of the slides that we have. Any more questions that are there for us can come up. I just want to share a picture of, apart from the things that we do here about with our job and all that, we also have a small community. Alhamdulillah, friends and family, all of us. We do try to take time to chill around, meet each other regularly. I'm sure all of the faces are here, so familiar people we know.
Sadiq, if you share the link for the UK aspirants, people who are interested in MRCP, if you get yourself into that group, and type in
Will do.
message, and then if you want, I can create a specific group.
Take it, Nabil bhai. I'll do that. I'll discuss it with Khalid bhai, and then I'll put it on the aspirants about MRCP. I think now we can move to the question answer session. Is everyone here still with us? Do we have people? Can we get a few thumbs up in the chat box, please? Oh yeah, that's one. Yeah, they are here.
Can we start with that passport thingy?
Yeah. Regarding the passport thing, I
I'm going
think
to share the screen. That will be easier. You're sharing it. That's fine.
yes. So
As you can see, this is the one. So you can see given name. There are two sections. The first one is surname and the second one is given name. So the issue was I had my full name is Altamash Ashfaq. So they had written Altamash Ashfaq in given name and my surname was blank. So that should not have happened. So your surname should be in the surname section, because if there is no surname, then you can't technically put anything in your surname in the UK. So make sure if you have your full name, it should be split as first name and surname. So your surname should not be blank. That is
see,
it.
this is what this is the corrected scene. On the right, you see no surname. On the left, you see with surname.
Can I just add a bit about the passport thing? So my given name is also Namir Faiz on the passport. I've got no surname. I've left it like that. I've registered with the GMC saying my first name is Namir and the surname is Faiz. And I've done that in the driving license as well.
Okay.
And alhamdulillah, it has worked fine for me. So अगर मेरा बस कहने का मकसद ये है कि if someone does have it,
lucky you, Namir bhai.
तो परेशान होने की चीज नहीं है. It's fine. It's a good issue to know about it now rather than later on. लेकिन मैंने अपना surname में Faiz डाला and it has worked all right. till yet.
लेकिन देखिए अल्तमश के साथ थोड़ा
For me,
problem
it was an
है.
issue to make HMRC account, and even my
Yeah, it was an issue for me as well, Altamash. मेरा नाम
अच्छा, अच्छा।
GMC पे डॉक्टर डॉट था.
Dr. Dot.
अच्छा,
I
अच्छा,
am also Dr. Dash in GMC.
भैया का भी फहद फैज का भी वही है, फहद फैज हाइफन है एंड में,
Hmm.
ये डॉट है।
Tanvir
Now,
also.
sometimes it create problem if you don't have a surname.
It's
Yes,
always a good
it is
idea to
okay
get
that you may not have a problem few person, but
हाँ,
actually most of the time they ask for the surname, and a few of the officers they are really very concerned about the surname. How can be your name without surname? Better to get it corrected.
Yeah.
And nowadays they have created problem in correction in everywhere, even in Middle East and also in India. Before it was that if you have the name and you are splitting the name without any paper notification, they made it. But now since 2 years, they want if any changes in the name, they want you to notify in the newspaper, one English newspaper, one Hindi newspaper, the local language, and then it will be get corrected. But I don't know that once if this notification happen, so later on sometimes if you are filling the form for any here in the UK, they ask for that what was your previous name. So do you have to fill that you have changed your name and now what was your previous name was something else and now your name is this. So it's sometimes it's a confusing, but better to get it corrected if someone has planned to come to UK.
Can I just say something? Can all the panelists, everyone who's done the presentation or is here to answer questions, just turn your videos on, please?
Yes, that would
So
be.
we can all
Thank
see
you.
them. And then Sadiq, you can go ahead with the questions. Mehtab, Manzoor, if you're still here, just turn your videos on as well.
I'm just scrolling through the chat box just to follow in order from when we started this thing. I think first we had some questions from Hania P saying she wanted to know if someone's in Newcastle, Scotland. I think.
Yes, she contacted me through the WhatsApp. Yeah.
Beautiful.
Then they were asking about passport, which is fine.
Mm-hmm.
And then they were asking about internship gap. What I meant by internship gap is most of the time when you're preparing for PG in India, NEET PG, then what you do is that you take months off in November and December to start preparing for your exam. So, and then later on you decide to come for PLAB. Then they will ask what was the reason that you took a break during internship, because it is not very common here, but people do take break. So as long as you are able to explain that this was the reason, I was preparing for an exam, or I was sick, or maybe I had some personal commitment, that was the reason that I took a break in my internship, it is fine. It is not an issue, but rather than going through all this paperwork and to and fro emails from GMC, it is always good if you're planning to come here through PLAB pathway, just do your internship straight away, 12 months continuously without any break, and that's it.
Thank you, Altamash.
That is really it. I don't think it's, I think I've made it clear.
Yes, you have. Altamash, someone's asking, why are you so handsome? I don't know how you want to do that.
Thank you.
There's someone asking if you have any pediatrics, seeking help from pediatrics. If anyone's here, they can reach Khalid Bhai or me.
Abdullah Bhai,
Yeah.
so what's
Yes,
the question about pediatrics?
So I don't know that was the question about the pediatrics.
The question
Have you gone through any question? I couldn't find it. So have you gone through that any question
Isne
that is
pucha tha
directed
if
to
they
pediatrics?
can just maybe raise your hand or unmute yourself.
I think it was from Wasim Shafi.
Wasim Shafi.
Yeah.
So what is his question?
He just
Question
wanted to know if somebody's from
nahi-
pediatrics, and I think now he can ask his question. So we have somebody from pediatrics now. Wasim, if you are still here with us.
Nope.
No, he's gone.
Scrolling down, I'll move forward. Aqsa Javed has asked, how difficult is PLAB to OSCE station? Can we compare it to final year practical exams? Well, I think cannot compare it to final year practical exams. PLAB 2 is easier. I don't think the final year exam 8 minutes, but the PLAB 2 does. It's easy. All they look for is how safe you are. And as long as you can prove a point that you are safe to see a patient in the English setup, you're good to go. It's easy. I wouldn't say
It is not
it would
difficult.
be as difficult.
It is just tricky.
Yeah,
They're
yeah.
looking for, you have to just complete the tick boxes that you are able to explain to the patient in a polite manner, and then it should be, easily understandable to the patient. It is more of a communication exam rather than a knowledge exam. So they're not checking your knowledge. They've already done that in PLAB 1. What they want to say is that once
I
you
say
have
this.
your GMC registration, can you talk to the patient? Can you make yourself clear? Are you a safe doctor? That's it. So it's more like what do you say? You just have to act that yes, I'm a safe
Yeah.
doctor. Yes, I can communicate myself. That's it.
Don't get nervous. Just say safety, seniors, pass.
Yeah. You can't
Next
compare.
slide says, please let us know about the job situation for post MBBS doctors with GMC after PLAB. This is what we're struggling with, aren't we?
Yeah, I mean, it has always been a struggle, but at the moment there has been, some changes. So people are finding it more difficult to apply for job now. But jobs keep on coming. You just need to apply properly. You have to build up your CV rather than applying for 500 posts half-heartedly. Go see where you are applying, write a good CV or your supporting information. Get few things done, because I know there are few people who are very proactive, even from 17 batch. They are doing audit, they are getting presentation done, they're visiting conferences. So if you have a good CV, so nobody is going to stop you from being selected and getting a job. But obviously it keeps on changing. I'm not saying that it's very easy. You have to put in an effort and then you can land a job. Because I came after PLAB. I just had internship experience, no other work, no clinical experience. Sadiq Bhai came, and then Tanveer Bhai is here as well. So people are getting job. I know a few other people have recently got job. So obviously it's just a time of waiting. So you can wait and then apply.
It's mostly
I
of
will add few things here, especially for the jobs. So those who had passed this one, PLAB 2, and still you have visa that you can come to UK. So do one thing that, because whenever you talk about, especially on the junior level job, SHO and fellow, so they ask that, have they done the attachment? Yes. So if you have done in any hospital, you are interested for the job, and if you have done the attachment in that department, most likely if you are okay with the work and all, if there is any position, they are going to take you. So it is a very, very much advantage. So if you have really planned, no, you want to come to UK, no other things, and if you have a visa valid still, because again, once you're coming for attachment, at that time also you need to with a valid visa. So you do some attachment, and whichever the department you like to work, do the attachment in that department. And attachment is not a very, I can say, the hard thing. Any one of the MU group or someone in the hospital, in which if he is working there, he can talk to the department colleague, like consultant or whoever the lead, and it's easy. If you have some rapport with the HR also, they will just process the paper and it can be. So please keep these things in your
I
mind.
think we need
Sometimes what also happens is when you do a clinical attachment, and if you're really good and you're noticed by your consultants, they do put up a locally employed post and then they create an interview
hire
and they hire you.
Yeah. It's a very, very much chances that, and I think that the MU pass out has this caliber. Whenever you are in the attachment, you will impress by your all activities. So not only the medical knowledge, other than the medical knowledge, is other things needed to impress the consultant or the department. And all the MU past graduates have this capability and ability. So it is very easy. If you have impressed within your 4 to 6 weeks, most likely you are going to get the job. I don't think that any MU pass out, if he do the 6 month or just 6 weeks of attachment, and if there is any post and he's not able to secure, I think he need more to just dig out that what he lacks in AMU. Not from the
I think
knowledge
India
point.
में काफी late हो रहा है. I think let's go through the questions quickly before we
Next we have Ariba Khan, who says, who's asked this question. Assalamu alaikum. I wanted to ask about the application to SC3 and for internal medicine as an IMG. How do we get the alternate competencies form signed? Do we need to take up PG here in India? Nabil Bhai, I think
that's for Nabil Bhai. Yeah.
So ST3, do you mean IMT? Or
yes.
Because they want to straight away apply for registrar position.
It's very difficult. Previously, बहुत easy था. लोग इंडिया पाकिस्तान से अपने कंसल्टेंट से फॉर्म साइन करा के सीधे ट्रेनिंग अप्लाई करते थे और मिल भी जाती थी, and that's why they've made it more difficult. So you need 6 months of geriatric rotation, you need 6 months of ITU rotation, and you need procedures competency sign, जो बाहर नहीं हो पाएगा. So you
certain
will
number of
probably
trainings.
have to come here, work in the UK before applying now.
Work as what, Nabil?
Even so, if you're planning for IMT, if you work as an SHO, and you can apply for IMT, but for specialty training, you actually need IMT or 6 months of geriatric or 6 months of ITU rotation. जहाँ पे भी आप जॉब कर रहे हैं उस ट्रस्ट से बात करके आपको साइन करवाना होगा.
Even for people who have done their MD in India or their MRCP in India, they should
मेरे
still
टाइम पे
be looking
रिक्वायरमेंट
for.
नहीं थी, but now they've changed it for the past 2 years.
So they should still
specialty-
be looking for SHO jobs first before moving to training.
And I wouldn't advise going into medical training directly without any NHS experience, because as a med reg, you have the responsibility for the whole hospital. And if you have like any error, it's very easy to get caught. So I think probably get
Alternate,
here.
Nabil bhai, alternatively, they can join as a trust grade registrar, isn't
Yeah,
it?
trust grade registrar.
And then try to apply for ST3 training.
All right. Thank you, guys. Thank you, Nabil Bhai, Nameer Bhai, Khalid Bhai. Nameer Bhai, next up, there's a question straight up directed at you.
Yeah.
Zuhair Khan, it says, Assalamu alaikum. My question is to Nameer, sir. I'm currently doing internship and I'm interested in surgical specialty. So I've got a few questions regarding the same. She says, number one, I've booked Club 1 and will be taking it next year, inshallah. Many of my batchmates are going for the MRCS pathway at this level only. So can you please guide me as to when it will be a good time to take this pathway, considering the fact that you told that some surgical techniques need to be demonstrated in the MRCS Part B? You finish this and then I can go with the second one.
I personally feel that the PLAB is an easier exam than MRCS. MRCS is a good pathway to follow. And that is the second alternative pathway, especially if you don't want to come to the UK to do the PLAB 2 here, you can still carry on. Lekin I would personally recommend, that's again it's not a requirement, but I would personally recommend that MRCS pathway should be followed by people who are in postgraduate training or who are spending their years in India working in a surgical, like non-acad JR ki job kar rahe ho surgery mein, surgical branches mein. I personally felt that it is still relevant to have some surgical experience to apply for the Part A as well as the Part B exams. Again, it's not mandatory. A lot of people are doing it. Or exams may, like Altamash said, there's a lot of acting to the exam rather than real skills or real things to be demonstrated. Excising a melanoma and suturing it up can be done without doing an MS surgery.
Bhai, the continuation mein sawal ye hai ki can you please tell a bit about the clinical attachments? Will it give me some advantage if it is done in a surgical field?
Yeah.
And is it possible and wise to get an attachment in a surgical department? I think surgical branch is what she meant.
And I think if you are planning for the PLAB pathway, you do have to come to the UK. You will be here for the exam. And that is the best time to get an attachment because you are already on a visitor visa. And I think that is relevant. Agar aapko koi attachment mil jaye, you should go for an attachment because when you start applying for jobs, eventually they would have to accept surgical attachment as NHS experience. Because NHS experience is a very, very big criteria in giving people jobs. So I think attachment is relevant if you can get one. I, alhamdulillah, was lucky to get my first job without a clinical attachment. But it is helpful. I think Altamash, Sadiq, everyone has done a clinical attachment before getting a first job.
Right. Thanks
I
very
want
much.
to make a comment. Sorry, just before we move on. Hannah has just written that I've seen many of my seniors are still looking for jobs after completing 2 attachments. So just to take that, Hannah, it's a very variable thing, and it very much depends on where you're working, kahan pe, kis department mein, kis hospital mein. And it's not a guarantee that attachment ke baad job milega, lekin it certainly improves your chances. So, aajkal, jaise Abdullah bhai mentioned earlier on in this meeting, यहाँ पे UK में I've been here for 20 years, no, almost 20 years. So the jobs come in waves. So 2-3 साल बहुत सारे jobs होते हैं, and then suddenly they die down for no apparent reason. They just vanish. So I think if you catch the wrong end of the wave, you'll probably struggle more than at other times. Lekin the only way to get a job is to just keep going. Or koi attachments will definitely help in the long run. Lekin there's no guarantee, unfortunately.
Another tip I would want.
Sorry, Sadiq. One important thing यहाँ पर जो देखने की है कि when you're coming for PLAB 2, उसके 3-4 महीने पहले से ही अपने जो भी AMU के सीनियर से सबसे कांटेक्ट करके, क्योंकि अटैचमेंट का प्रोसेस बहुत मुश्किल है आजकल. एंड मतलब कि आपकी कोई जानने वाले हैं, उन्होंने आपको HR को बोल के मामला सेट करा दिया, बट स्टिल HR विल टेक 8 वीक्स. और वो कई बार आपसे कोई ऐसा डॉक्यूमेंट इंडिया से मांगते हैं, कई बार आपको PLAB 2 के लिए PCC नहीं चाहिए होता, पुलिस क्लियरेंस, बट कई बार वो क्लिनिकल अटैचमेंट के पहले बोलते हैं कि पुलिस क्लियरेंस सर्टिफिकेट लाओ, और यू कांट PLAB 2 के बाद यू कांट गो बैक टू इंडिया एंड गेट इट. तो अगर आप PLAB 2 के पहले और PLAB 2 के आने के जस्ट पहले आप एग्जाम की तैयारी कर रहे होगे, तो यू डोंट वांट टू गेट डिस्टर्ब. तो 4-5 महीने पहले जब मतलब प्लान अहेड और लोगों से टच में आया कि मुझे क्लिनिकल अटैचमेंट मिल जाए, ताकि जब आप आए यहाँ पे तो कुछ ऐसा डॉक्यूमेंटेशन जो आपको मे बी PCC वगैरह चाहिए होगी. कई सारे ट्रस्ट आपको, क्योंकि वो आपका DBS नहीं करवा सकते हैं उस टाइम पे, तो वो PCC मांगते हैं इंडिया से कई सारे ट्रस्ट. और मैं कई लोगों को जानता हूँ बीन पेइंग लाइक 2-3 हजार पाउंड टू डू एन अटैचमेंट. लंदन वगैरह में कई सारे ट्रस्ट they're asking for money for attachment. तो attachment मुश्किल है, but definitely it helps in a job. और and the thing is that all of us we only do all those things जो अपने हाथ में है, like attachment या ऑडिट वगैरह. इंडिया में कोई भी टाइप का नॉट अ वेरी गुड ऑडिट, बट कुछ भी ऑडिट करे ताकि आप उनको बता सके कि मुझे ऑडिट क्या है समझ में आता है, क्लिनिकल गवर्नेंस क्या है समझ में आता है, और मैंने एक टाइम पास ऑडिट कर रखा है, so I've got an idea, so मैं UK आके बाकी कर लूंगा. So you just need to impress them in the interview.
That is right. And not every hospital is giving attachment at the minute, क्योंकि मैंने 3-4 लोगों से मैं टच में हूँ, they are also looking for attachment and jobs. मैंने अपने हॉस्पिटल में जाके बात की थी, and they are like literally they're saying that they are not taking any more clinical attachment. So that varies from one trust to other. So you can't always say कि आप जहाँ अप्लाई कर रहे हैं वहाँ attachment मिलेगी आपको.
और दूसरी बात ये, कई लोगों को जानता हूँ अटैचमेंट पूरा फाइनल होने के बाद HR ने 8 हफ्ते टाइम लेने के बाद एंड में उनसे PCC मांग लिया, और वो कोई अगर यहाँ पर है they're waiting for the attachment to get through, और फिर वो PCC नहीं ला सकते, they had to go back without the attachment. So yeah, plan ahead in time.
Another thing what I personally want to add to this is, आप जब जॉब के लिए अप्लाई कर रहे हैं तो first priority पे just try to get into the NHS. Don't be very stubborn with your choice of
Yeah.
So I've seen a lot of people who wanted pediatrics, a lot of friends who said I नहीं OBG करना है तो OBG करूंगी वरना नहीं आऊंगी. तो just don't stick to that, because पहले था शायद वो option, अभी नहीं है. ED is a space where you can get a job easily, क्योंकि EG में requirement और vacancy का supply demand वाला चीज हमेशा चलती है.
ED and medical jobs सबसे easiest.
हाँ, तो try to get any job you have, work for a couple of months, and then maybe you can make the switch to your work.
I think this is a really important point, Sadiq, क्योंकि इंडिया में स्पेशली हम लोग इंडिया में थे तो it's not very easy to change specialties इंडिया में. हम लोगों का ये होता है MBBS के बाद you choose a specialty and then you're stuck with that for life. तो यहाँ पे ऐसा नहीं है. यहाँ पे it's very very easy to change specialties. आप a few months later, a few years later, it's very easy to change it.
And applying, because I've been through this process very recently, I see this when you apply for a job, usually you do it on track or NHS jobs. When you start an application, it says, have you worked or do you have NHS experience? So when you say yes, when you say no, half of the applications don't even take you forward. So in that forward, I say, just come here, spend some time in whatever trust, wherever you are, get into the system, work, get your work done on your CV, and then we can make that switch.
That is right.
I hope that answers this question.
A question, Abdullah bhai ka jo PEDS wala tha, Wasim is asked again. So Abdullah bhai, basically Wasim Shafi ka question hai. He wants to know कि MRC, PH और MTI pathway इसके बारे में and क्या preparation करनी होती है and any specialization अगर PEDS में करनी हो तो उसके लिए क्या?
अगर इसमें अगर he has done the MRC PCH or is still not done?
अब ये बताया नहीं उसने.
अच्छा, तो by the way MRC PCH एग्जाम अगर कोई अलीगढ़ से जैसे कि DCH या MD PEDS वगैरह करते हैं तो I don't think that's it's a big deal now. And if they have any planning to come to UK, at the same time when they are doing the MD, they can do these especially the part 1 that is called now FOP, and also the part 2, the written exam, and that's AKT, applied knowledge of theory something, and then the third part nowadays in India also. So those who has done the doing MD in India or even the DCH, for them it's not a big deal to pass this exam. And once you have done the MRCPCH, you are eligible for what called GMC registration without PLAB. So this is one of the advantage that doing the MRCPCH. Without passing the PLAB, you can be registered here. And after that, if you have at least like 3 years of MD experience or whatever the experience in India and even in the Gulf region, if you have worked after the post MD, so it will be taken as a IMG, International Medical Graduate. So you can directly apply for the registrar job. And from the registrar job, you are eligible for again the ST3 level training. So I think if somebody is doing and have some plan to come to the UK in pediatrics, and they are already in the pediatrics there in India, MRCPCH is a good path to come here. And then most likely, if you are, most of the time it happens that आपको लोग डरा देंगे कि रजिस्ट्रार जॉब पे जाओगे, बहुत लाइबिलिटी हो जाएगी, ऐसा कुछ नहीं है. आपने इंडिया से MD किया, DCH किया, आप इजिली यहाँ पे रजिस्ट्रार लेवल पे जॉब आप कर सकते हो. और उसके बाद से जो कुछ चीजें जैसे होती है, कहते हैं कि चलो चाइल्ड प्रोटेक्शन, ये भी कोई बहुत बड़ी चीज नहीं है. यहाँ आप आके आपने काम किया, 2 महीने 3 महीने में चाइल्ड प्रोटेक्शन के बारे में भी जान जाते हैं. तो ये, लेकिन बहुत सारे लोग हैं, अगर आप बाहर से बात कर रहे हो, और डूइंग द पीडियाट्रिक प्रैक्टिस इन UK इज वेरी डिफिकल्ट, स्पेशली दे विल टॉक अबाउट द चाइल्ड प्रोटेक्शन एंड चाइल्ड सेफगार्डिंग. तो आराम से आप करें MRCPCH, और इस पास से आना चाहे तो आ जाएं, और नहीं अगर उससे पहले आपने MD वगैरह नहीं किया है तो ऑफ कोर्स द बेस्ट पाथ इज टू डू द PLAB एंड कम हियर एंड ज्वाइन एज ए SHO, एंड देन यू कैन प्रोसीड योर कैरियर हियर इन ए ट्रेनिंग आल्सो.
Thank you.
जस्ट टू ऐड अब्दुल्ला भाई, ये पीडियाट्रिक्स में MTI की जॉब्स काफी निकलती है, जिसमें कि आपको MRCPCH वगैरह की जरूरत नहीं पड़ेगी. अक्सर देखने को मिलती है न्यूनेटोलॉजी वगैरह में MTI की पोस्ट 2 साल की. तो MTI की पोस्ट पीडियाट्रिक्स में काफी निकलती है. जस्ट हैव टू बी ऑन द लुक आउट.
हाँ, लेकिन वही है कि ये MTI की वो लेवल 3 हॉस्पिटल्स में यूजुअली होती है वो जॉब. और उसमें भी फिर आजकल मैंने देख लिया कि फिर वो डिपार्टमेंट जहाँ अप्लाई कर रहे हैं वहाँ ना कोई वास्ता या कोई लेने वाला हो तभी मिल पाता है, क्योंकि वो रॉयल कॉलेज के थ्रू से आते हैं. तो इट्स वन ऑफ द, वो तो रास्ता है ही है. लेकिन अगर कोई, मैंने इसलिए बता दिया ना कि मोस्ट ऑफ द लोग जो वहां से इंडिया से आना चाहते हैं, तो वो पीडियाट्रिक्स में वही आना चाह रहे हैं जो वहाँ DCH या MD वगैरह में है. तो अगर वो वहां ऑलरेडी उसमें है, तो उनके लिए सबसे अच्छा है कि आप ड्यूरिंग द योर पोस्ट ग्रेजुएशन यू डू द MRCPCH, so that once you have completed the same time you can come at the level of at least ST3, so you have not to go again from the SHO level and ST1. तो 3 साल 4 साल की आपकी ट्रेनिंग ऑलरेडी कंप्लीट मानी जाएगी. अब फिर आप 3 या 4, चूंकि अब जो है वो पहले 8 साल का था पीडियाट्रिक्स ट्रेनिंग, अब उसे उन्होंने शॉर्ट करके 7 साल का 7 इयर्स का कर दिया. ये भी एक एडवांटेज है. तो लेकिन बहरहाल ये सब सारे रास्ते जो बताए हैं उससे आ सकते हैं.
Wasim का मैसेज आया है, is about to complete MD pediatrics. I think Wasim, the best thing for you is, अगर if you're already completing MD pediatrics, you can certainly go for MRCPCH. अभी इस टाइम मतलब पढ़ाई भी हो गई होगी, and you can certainly do that. One thing you can do is English exam करके, कोई भी English exam करके, you can start applying for MTI jobs. So I think that MTI jobs में advantage ये है कि you don't need just the English exam, और उसके बाद फिर you don't need any other exam. PLAB भी नहीं चाहिए, MRCPCH नहीं चाहिए. So you might get lucky.
MRCPCH में सारे पार्ट्स करते करते 2 साल तकरीबन लग जाएगा. तो मतलब there's a way to skip that.
Yeah.
सही बात.
So you
MTI
can keep
के थ्रू आ सकते हैं. हाँ.
Keep working on your English exam करके, keep working on your MRCPCH. बीच में job यहाँ पे मिल गया तो just come over.
सही बात.
There is a query that has come up with surgical group में, वो मैंने आपका link number share किया है. Maybe someone needs to get added.
I've already added the people who have wanted to go to MRCS group.
एक और सवाल है, Hana Khan's asked, is it better for MBBS grade with GMC to go for NEET PG now instead of sticking for a job search? No, I'd say stick to your job search. Don't need PG.
नीट पीजी हमेशा से बेहतर ऑप्शन था, सादिक और अल्तमश लकी रहे।
Alhamdulillah.
मैं तो सबको बोलता हूँ इंडिया से पीजी करके आओ, सही
Right.
पे कम से
हाना तो
कम।
यहाँ पे है ऑलरेडी, हाना इज ऑलरेडी हियर, तो आई थिंक अभी परेशान है क्योंकि जॉब नहीं मिल रहा है, लेकिन हाना यू विल सर्टेनली गेट अ जॉब इंशाल्लाह। आई मीन
Yes, yes.
it's a matter of time. ये once you've got your GMC registration, it's only a matter of time. उसके बाद तो
Stubborn, man. We've been trying for. I also tried to speak to my consultants for a CV and stuff. Please
Yeah,
send
I
us-
would suggest do as what you are doing in India and just applying for the jobs here. And once you get a job, come here. Don't like think one anything. That's what I did. Like I passed my MBBS in 2011, and then I gave lots of exams. But I was not getting job. But I did pursue my things in India. I didn't wait for anything. And as I said, the jobs here come in bunches. So when I applied second time, there was too many jobs in oncology. And I got and I came. I didn't wait for anything. So just I would say whatever you are getting in India, continue with that. And once you get a job here, come here. It will come. The jobs will come here. It's just a matter of time.
next year इंशाल्लाह हाना का भी presentation होगा इसमें.
Inshallah, inshallah. Let's hope she's here.
Inshallah.
Nadeem Ahmed has a question. He says, I've been applying for middle grade jobs in the UK, currently working in India. What are the factors on which an invitation for interview depend? How to make it more appealing to the employer?
Most
I
important
would
depends
say
upon
there are
which
no
department
factors.
she's
It's
applying.
basically a job. Like if there are only 4 jobs and 700 applications are coming, what's the factors? There's no factors. It's just the availability. If once the availability is there, the jobs, you will get the interview. That's the most important thing I would say. If the jobs are like 4 applications, 8, 10 applications, four positions, then there the matters the things. But if 704 jobs, then what? I don't think so much would matter with the application point of view.
Yeah, I think what he's trying to ask is कि कुछ कर सकता, can he do something to improve his CV, just to improve his chances of getting shortlisted?
I think he can continue the clinical work. Like if he wants to come in emergency medicine or oncology, whatever he is doing, just continue there. And the other thing that he can do from India is research or audit. That's the thing that he can do. These 2 things, like don't wait for the things, like just do what you can do at your end. The most important is audit and research that he can do from India.
Yeah. Nabil?
Nadeem Boss is a senior of mine. उन्होंने MRCS कर लिया. He's working as an assistant professor in IGMS Patna. So I'm in touch with him. We started applying for jobs for a month or 2. Lekin he's got 1 interview yet, so we'll see how it goes. Abhi thoda sa, I think like we said, the job market goes in waxing and waning phases. I think we're in a bad phase now.
Abhijit,
एक चीज और है ना, आने से पहले ये तो डिसाइड करे कि क्यों आना चाह रहे हैं यूके में।
जी
अगर किसी को इंडिया में ही प्रैक्टिस करनी है और या हॉस्पिटल है उनका अपना, तो मैं तो कभी नहीं एडवाइस करूंगा कि आप यहाँ पे जॉब के लिए इतना परेशान हो, फिर प्लाप करे ये करे। आप उसी को मजबूत करें। हाँ, किसी को अपनी लाइफ यहाँ बनानी है, यूके में रहना ही यही है, अब इंडिया में नहीं रहना है, तब तो फिर ठीक है आजकल। क्योंकि आजकल आप देखें यहाँ पे जो प्रैक्टिस क्या है, जितने भी जो कंसल्टेंट, मोस्ट ऑफ द कंसल्टेंट इवन के द नॉट फ्रॉम द इंडियन एंड पाकिस्तान बैकग्राउंड, इवन द जो भी यूरोपियन कंट्रीज, द अफ्रीकन कंट्रीज, देयर बैकग्राउंड इज डिफरेंट, लाइक इंग्लिश, दे मूविंग टुवर्ड्स द ऑस्ट्रेलिया एंड अदर कंट्री लाइक दुबई एंड ऑल, बिकॉज के आप आगे जाके जैसे कुछ लोगों का होता है कि भाई कमाना भी है, तो कमाना तो बहुत ज्यादा नहीं है यहाँ पे, नहीं है डॉक्टर आपको। तो पहले ये डिसाइड करे जो भी आ रहे हैं वो लाइफ को समझ के आए, क्योंकि कुछ लोगों को मैं जानता हूँ आने के बाद यहाँ डिप्रेस हो गए, उनकी लाइफ ये हुई कि चूंकि एक्सपेक्टेशन कुछ और होता है, बस सिर्फ नाम पे कि यूके जाना है, चले तो आते हैं, उसके बाद में जो चीजें उनकी ख्वाहिशें होती है वो पूरी नहीं होती है। तो फर्स्ट दे शुड डिसाइड दैट कि उनको लाइफ में क्या करना है।
जी, एक अभिजीत कुमार का मैसेज है कि काइंडली शेयर द MRCP प्रेजेंटेशन। आई एम MD मेडिसिन विद OET क्लियर्ड स्टेटस, लुकिंग फॉर स्पॉन्सरशिप पाथवे। सो इफ यू कैन टेक्स्ट Khalid bhai, I think he will get back. Abhijit Kumar, I don't know if you're still here or if you've left.
What do you mean by the
MRCP
sponsorship
preparation
pathway?
group कोई किसी और किसी और के पास था ना, नबील या कोई uncle.
MRCP की slides, Sadiq, if you want to share, it's fine.
नहीं, I don't think he wants to slide. वो उसको कोई ग्रुप का लिंक कोई है ग्रुप
Group अब JNMC का तो खालिद भाई एक था, लेकिन if people want to make a group, then if you add them to the aspirants group, फिर मैं filter करके एक group बना लूंगा फिर.
ठीक है, fine, we'll do that. लेकिन उसके लिए advice, I think if you're doing your MD medicine और OET हो चुका है, I think you're pretty much set
WhatsApp
up
group,
for
you're looking
the
for
MTI
WhatsApp group.
pathway.
MTI pathway खालिद भाई भी बहुत down चल रहा है.
अच्छा, okay.
Medicine खासकर, because they are easily getting people with MRCP for jobs.
Right. So would you suggest PLAB करे फिर अभिजीत?
जल्दी आना है तो PLAB, or if you want to just start getting MRCP part 1 and 2 in India.
Isna has a question. It says, my doubts are regarding visa for LAB 2 exam. Does it strengthen your application if you show parents as sponsor, or is it equally strong if you show yourself? Second question is, proof of regular income is required and income from a particular source is required to show, or only bank statement will do? I think to answer the first part of your question, as long as you have a stable income in your bank account, be it yours or your parents, in the last 6 months, it will not affect or impact your visa application in any which way. ऐसा नहीं होना चाहिए कि आपने अभी 5 लाख ट्रांसफर किए और कल अप्लाई कर रहे हैं. That might be a bit dubious, and then they might ask you for that. Otherwise, there is no problem if you have a stable income coming in, bank account is working, there are transactions, you can show a statement, good to go. Second question is, proof of regular income is required for particular.
Only for 6 months.
Required. I think that again answers the same point. If you have a stable bank balance, which is enough for your survival in the time you are in UK. अगर ऐसा कोई है जो आपको स्पॉन्सर कर रहा है, तो I have known people who even come in with 2 lakh rupees, who's had invitations from someone जो accommodation और खर्चा उनका क्लियर था, तो उन लोगों ने 2 लाख दिखा के आए हुए हैं. But अगर वैसा नहीं है, तो I think, you know, if you show that your bills are paid, your flights are booked, it'll be good. ऐसे कोई वो खास it doesn't make or break your application.
It's always best to show money in your own account rather than you're showing your parents as sponsors. और दूसरी बात इसमें ये है कि obviously no large transactions in the last 3 months. वो लोग शायद 3 महीने, तो आपको जो पैसा अपने पेरेंट्स से लेके अकाउंट में डालना है 5-6 महीने पहले लेके डाल लीजिए, उसको वहीं रहने दीजिए. Don't move, no funds coming in and no funds going out, no large transactions. मतलब आई थिंक रेगुलर इनकम का मतलब है कि चलो मुझे अगर 50,000 या 70,000 सैलरी हर महीने आ रही है, तो दैट काइंड ऑफ एड्स अप, क्योंकि दैट शोज योर अटैचमेंट टू रूट्स कि तुम यहाँ जॉब कर रहे हो एंड देन तुम प्लैब 2 देके वापस लौटोगे, तुम इलीगल यूके में नहीं रुक जाओगे. तो हैविंग अ जॉब काइंड ऑफ रीइंफोर्सेस होम ऑफिस के मन में कि हाँ ये बंदा वापस लौटेगा एग्जाम देके. बट या मतलब बट रेगुलर इनकम नहीं है, डजंट मैटर, एंड यू कैन ऑलवेज शो दैट टाइम एज प्रिपेयरिंग फॉर एग्जाम जब जीएमसी कराएंगे. बट या डोंट नो लार्ज ट्रांजैक्शंस द लास्ट कपल ऑफ मंथ्स. तो वीजा के लिए भी प्रिपेयर करना पड़ता है, लाइक यू नीड टू प्रिपेयर 6 मंथ इन एडवांस जब तुम्हें वीजा अप्लाई करना है. सो दैट यू नो यू डोंट, बिकॉज प्लैब 2 वीजा रिजेक्शंस बहुत कॉमन है.
करेक्ट. एक और सवाल है फाद भाई कि आफ्टर प्लैब 2 if I'm applying for a job in UK, will private practice in a nursing home be helpful in the process? Yes. I think any job you do, and as long as you have a work experience certificate, that will only add up to your CV, that you know you've been practicing, you are in continuous clinical practice. It will help you if you're waiting for a job in the UK.
तो प्राइवेट प्रैक्टिस मतलब वो NES की बात हो रही है या इज इट समथिंग एल्स?
नहीं, NES की नहीं, इंडिया में प्रैक्टिस की बात हो रही है कि अगर मैं नर्सिंग होम पे बात काम कर रही.
बिल्कुल. if you can stay working in India, कोई भी मतलब कि even if somebody is like, आप हफ्ते में 2 दिन भी काम करते हो, कोई आपको सर्टिफिकेट ये देने को तैयार है कि ये मेरे यहाँ काम कर रहा है और मैं इसे 50,000 सैलरी देता हूँ या 40,000 सैलरी, तो दैट वुड बी एनफ.
एक चीज यहाँ पे आई थिंक मैं बस ऐड कर दूं कि इंडिया में डिफरेंटली देखते हैं जॉब्स को ना, कि मतलब वेयर यू वर्क एंड यू नो प्राइवेट में काम कर रहे हैं, गवर्नमेंट हॉस्पिटल्स में. व्हेन यू अप्लाई टू अ जॉब यहाँ पे यूके में, अपनी सीवी में, व्हेन यू कम हियर यू रियलाइज के a lot of the application part is basically playing yourself up, और you know अपने आप को थोड़ा सा बढ़ा चढ़ा के बताना होता है, and how you spin things also matters. So as long as you can show them कि किसी private hospital में काम कर रहा है, तो what you've done, so you don't need to say कि private hospital में काम कर रहा है, you just say कि इस जगह काम कर रहा है, and this is what you've done, these are the skills that you've learned, and these are the competencies that you've got. So that's all that matters. As long as कोई experience है where you can show कि कुछ competencies जो relevant competencies हैं वो हैं आपके पास, that's all that matters. It doesn't matter where you work.
Right. I think we've covered most of the chunk of questions that are there. I think we covered every question that there is. I'm just scrolling back up to check और कोई सवाल तो छूट नहीं गया हमसे. I don't think so. और भी कोई हैं who are still here with us, who have a question, can I think open their mics and go ahead and ask their questions. I will keep the chat box open. अभी भी कोई questions हैं तो आप you can leave it us. A little bit of feedback on the session will also do. Anything you want, you can easily type in the chat box. Let us know what we can improve for the next time.